Hello, I'm Dr. O'Connor, a geriatric specialist, and I want to speak with you about a growing health concern that affects both seniors and younger adults: stomach and colon cancer. For many years, these cancers were thought of as conditions that primarily developed later in life, but today we are seeing an alarming rise in cases among younger people in their 30s and 40s. In seniors, long-term factors such as age, genetics, and lifestyle play a role. But in younger adults, we believe diet high in processed and red meats, lack of exercise, smoking, alcohol, obesity, and even chronic stress are major contributors. What makes these cancers especially dangerous is that the early symptoms, abdominal pain, changes in bowel habits, fatigue, unexplained weight loss, or blood in the stool, are often ignored or mistaken for less serious conditions, which delays diagnosis until the cancer has already progressed. But here is the encouraging news. Prevention and early detection truly save lives. By eating a diet rich in fiber, vegetables, whole grains, beans, and fruits, while cutting back on processed foods, fried items, and alcohol, you can significantly lower your risk. Staying physically active, even with simple daily walking, helps your body regulate digestion and metabolism, further protecting your colon and stomach. For seniors, routine screenings, such as colonoscopies, are not just recommended but essential, as they can actually prevent cancer by removing polyps before they turn dangerous. For younger adults, it is critical not to dismiss symptoms. If something feels wrong, see your doctor promptly, because early intervention can mean a simple procedure rather than advanced treatment. As a geriatric and cancer doctor, I cannot stress enough that cancer does not discriminate by age, but through awareness, preventive choices, and timely screenings, we can change the outcome. Each healthy choice, from replacing one processed meal with fresh vegetables to encouraging loved ones to get screened, adds up to a powerful defense. Together, we can lower the growing tide of stomach and colon cancer, protect our health, and secure a longer, healthier life for ourselves and the people we love.
What if I told you that colon cancer rates are skyrocketing among people in their 20s and 30s, defying everything doctors thought they knew about this deadly disease? The statistics are genuinely alarming, and the reasons behind this surge might surprise you completely. Hello everyone, and welcome back to our channel where we discuss critical health topics that could save your life. I'm your host, and today we're diving deep into the warning signs of colon cancer that too many people ignore until it's too late. This isn't just another medical video. We're going to explore why younger people are increasingly at risk and what you can do right now to protect yourself. Colon cancer has earned its reputation as a silent killer for good reason. It currently stands as the third most frequently diagnosed cancer worldwide and tragically ranks second in cancer-related deaths. Cancer registries across multiple countries are reporting significant increases in colorectal cancer diagnoses among individuals under 50 years old. Some regions have seen increases of up to 30% in this younger demographic over the past 2 decades. This shift challenges our fundamental understanding of who's at risk. Traditional risk factors like age and family history, while still important, no longer tell the complete story. Genetics account for only 5 to 10% of colon cancer cases, leaving a massive gap in our understanding. The emerging picture suggests that our modern lifestyle and dietary patterns play a far more significant role than previously recognized. Think about how dramatically our eating habits have changed over the past generation. Ultra-processed foods now dominate grocery store shelves and dinner tables worldwide. These products, loaded with preservatives, artificial additives, and inflammatory compounds, create an environment in our digestive system that promotes cellular damage and inflammation. Research has definitively linked ultra-processed food consumption to increased cancer risk, yet many people remain unaware of this connection. The geography of colon cancer within your body matters tremendously for symptom recognition. Tumors developing on the right side of the colon behave very differently from those on the left side. Right-sided tumors grow in an area where intestinal contents remain liquid, allowing these cancers to reach considerable size before causing noticeable problems. This explains why right-sided colon cancers often go undetected for extended periods. Early detection becomes crucial when dealing with such a stealthy disease. One of the most reliable early warning signs involves changes in your bathroom habits. If you've maintained regular bowel movements throughout your adult life and suddenly experience persistent constipation lasting weeks, this warrants medical attention. Similarly, if your stool consistently appears thinner than usual, resembling pencil thickness, this could indicate a mass partially blocking your intestinal passage. Hidden bleeding represents another critical early indicator that most people overlook. Colon tumors frequently bleed in microscopic amounts that aren't visible to the naked eye. This chronic blood loss gradually depletes your iron stores, leading to anemia. If you're experiencing unexplained fatigue, weakness, or notice your skin appearing paler than normal, especially if you're over 45, these symptoms combined could signal intestinal bleeding. The difference between right and left-sided colon cancers becomes more apparent as tumors progress. Left-sided cancers tend to cause earlier symptoms because intestinal contents have solidified by the time they reach this area. Patients often experience alternating episodes of diarrhea and constipation, abdominal cramping, and more visible bleeding. The blood in these cases typically appears bright red rather than the dark tarry appearance associated with upper digestive tract bleeding. Advanced colon cancer symptoms extend beyond the digestive system. Persistent abdominal pain, unexplained weight loss, and chronic fatigue indicate the disease may have progressed significantly. When cancer spreads to other organs, symptoms can include liver pain from metastases, shortness of breath if lungs are affected, or bone pain if the skeletal system becomes involved. Prevention strategies have evolved dramatically as our understanding of colon cancer development has improved. The transformation from normal intestinal tissue to cancer typically begins with small growths called polyps. These initially benign structures attach to the intestinal wall like tiny mushrooms. Most polyps remain harmless throughout a person's lifetime, but certain factors can trigger their transformation into malignant tumors. Diet emerges as the most modifiable risk factor in preventing this transformation. Foods rich in antioxidants and anti-inflammatory compounds create an internal environment that discourages cancer development. Colorful fruits and vegetables provide these protective compounds naturally. Berries, leafy greens, cruciferous vegetables like broccoli and cauliflower, and deeply pigmented produce offer the highest concentrations of cancer-fighting nutrients. Healthy fats play an equally important role in cancer prevention. Omega-3 fatty acids found in cold water fish, flax seeds, and walnuts help reduce inflammation throughout the body. These beneficial fats actually influence gene expression, potentially silencing genes associated with cancer development while activating protective pathways. Conversely, certain dietary patterns accelerate cancer risk. Excessive consumption of processed meats like bacon, sausages, and deli meats introduces compounds that damage intestinal cells. Red meat consumption, while not inherently dangerous, becomes problematic when it dominates your protein intake, or when prepared using high-temperature cooking methods that create carcinogenic compounds. The role of fiber in colon health cannot be overstated. Adequate fiber intake promotes healthy digestion, feeds beneficial gut bacteria, and helps eliminate potentially harmful compounds from your system more rapidly. Most adults consume less than half the recommended daily fiber intake, creating an environment where toxins linger longer in the digestive tract. Developing healthy coping mechanisms, whether through meditation, social connections, or professional counseling, contributes to overall cancer protection. Regular physical activity reduces cancer risk through multiple mechanisms. Exercise enhances immune function, improves circulation, reduces inflammation, and helps maintain healthy body weight. Even moderate activity like brisk walking for 30 minutes daily provides measurable protective benefits. Sleep quality affects cancer risk through its impact on immune function and cellular repair processes. During deep sleep, your body performs critical maintenance functions, including DNA repair and immune system restoration. Chronic sleep deprivation compromises these protective mechanisms, potentially allowing damaged cells to proliferate unchecked. Stress management deserves attention in any comprehensive cancer prevention strategy. Chronic psychological stress elevates cortisol levels and promotes inflammation throughout the body. Screening recommendations have evolved to reflect changing demographics and improved understanding of colon cancer development. Current guidelines suggest beginning colonoscopy screening at age 45 for average-risk individuals, with some organizations recommending even earlier screening for certain populations. Those with family histories of colon cancer should typically begin screening 10 years before the age at which their relative was diagnosed. The colonoscopy procedure itself has become significantly more comfortable and accurate over recent years. Modern sedation techniques ensure patient comfort, while advanced imaging technology improves polyp detection rates. The procedure allows not only visualization of suspicious areas, but also immediate removal of polyps for laboratory analysis. Alternative screening methods exist for those unable or unwilling to undergo colonoscopy. Stool-based tests can detect hidden blood or DNA markers associated with cancer. While less comprehensive than colonoscopy, these tests provide valuable screening options when performed regularly, as directed by healthcare providers. Understanding your personal risk factors empowers you to make informed decisions about prevention and screening. Family history remains important, but lifestyle factors often outweigh genetic predisposition. Creating a comprehensive prevention plan involves honest assessment of your current habits and gradual implementation of healthier choices. Environmental factors also contribute to colon cancer risk in ways researchers are still discovering. Exposure to certain chemicals, pollutants, and toxins may increase cancer risk over time. While you cannot control all environmental exposures, minimizing unnecessary contact with known carcinogens supports your overall health strategy. The connection between gut health and cancer prevention continues revealing new insights. Your intestinal microbiome, the collection of bacteria and other microorganisms living in your digestive system, influences inflammation levels, immune function, and even gene expression. Maintaining a healthy microbiome through diverse fiber-rich foods and potentially beneficial bacteria supports your body's natural cancer-fighting abilities. Alcohol consumption represents a modifiable risk factor that many people underestimate. Even moderate drinking increases colon cancer risk, with risk rising proportionally to consumption levels. If you choose to drink alcohol, limiting intake to recommended guidelines and ensuring adequate folate consumption may help mitigate some associated risks. Smoking's connection to colon cancer, while perhaps less obvious than its link to lung cancer, is well established. Carcinogens from tobacco smoke enter the bloodstream and can affect cells throughout the body, including the digestive tract. Smoking cessation provides immediate and long-term health benefits, including reduced cancer risk. The importance of maintaining healthy body weight extends beyond appearance or cardiovascular health. Obesity creates chronic inflammation, alters hormone levels, and may impair immune function. These changes create an environment more conducive to cancer development. Achieving and maintaining a healthy weight through balanced nutrition and regular activity supports comprehensive cancer prevention. Taking action based on this information doesn't require dramatic overnight changes. Start by honestly evaluating your current diet and identifying areas for improvement. Gradually increase your consumption of colorful fruits and vegetables while reducing processed food intake. Incorporate regular physical activity into your routine, even if you begin with short walks or simple exercises. Pay attention to your body's signals and don't dismiss concerning symptoms as normal aging or stress. Changes in bowel habits, unexplained fatigue, or persistent abdominal discomfort warrant medical evaluation. Early detection dramatically improves treatment outcomes, making awareness of potential warning signs invaluable. Building a relationship with a healthcare provider who understands your personal risk factors and health goals enables personalized prevention strategies. Discuss your family history, lifestyle factors, and screening options to develop an appropriate plan for your situation. This proactive approach demonstrates commitment to your long-term health and well-being. Remember that preventing colon cancer isn't about achieving perfection in every aspect of your lifestyle. Small, consistent improvements compound over time to create significant health benefits. Focus on sustainable changes that you can maintain long-term, rather than extreme measures that prove difficult to sustain. This information empowers you to make informed decisions about your health, but it never replaces professional medical advice. If you have concerns about colon cancer symptoms or risk factors, consult with qualified healthcare providers who can evaluate your specific situation and recommend appropriate testing or treatment options. Your proactive approach to understanding and preventing colon cancer represents an investment in your future health and quality of life that will benefit you for years to come.